Thanks for asking. I mean, this is why as a primary care, I'm so interested in this. If it was just a tooth getting injured and then having to be removed or getting a filling, that would be one thing. But when you get disease in your teeth and then you get disease in your gums that surround the teeth, then you get inflammation in your body. As that drifts off around the body, it affects heart disease, it affects diabetes, it affects, I mean, believe it or not, they're finding links to Alzheimer's and other things.
Hello and welcome to Healthy Living. I have Dr. Hugh Silk. He's a doctor, a primary care physician at UMass. Welcome, Dr. Silk.
Yeah, thanks for having me.
You're welcome. So we were talking a little bit before we started, and I'd like to know a little bit. I know we're in the midst of a pandemic right now, but there are certain things it sounds like you're pretty passionate about, and one of those is oral health. And you're being a primary care physician. How did you get interested in the importance of oral health?
Yeah, no, thanks for asking that, because I think it's important to set the stage for this. I was a family medicine resident at Hahnemann Family Health through UMass, and I was seeing young children who had a lot of oral health issues, a lot of cavities, and I couldn't figure out why that was. And then I learned about there not being fluoride in the water and access issues for children on Mass Health. When I would turn to my faculty mentors, they didn't know anything about this. They knew everything about high blood pressure, everything about diabetes, but not about this. So I took it upon myself to sort of educate myself, talk with dentists, and then started trying to train my colleagues about it. And believe it or not, I was the only person at the time, and then found a couple others. And this became like a national movement to get physicians to know more about the mouth. We know everything about the eyes, about the heart, the feet. Why don't we know something about the mouth?
Wow. And it sounds like a kind of a grassroots beginning. You have a personal interest. Do you is that what all your time is spent, or are you still doing the traditional 90% primary care internal med stuff, and then this is just on the side? Is that how it evolved?
Right. Yeah. I'm a primary care provider, so I'm seeing patients. But I do find grants nationally and locally to work on oral health issues. So for example, we've been going into pediatrician and family doctor's offices, training them to look in children's mouth, training them to put fluoride varnish on children's teeth. It's actually a national recommendation that physicians and nurse practitioners apply this varnish to kids' teeth, and then the children have less cavities. So it's not that they get that in the dentist office, they get that in the doctor's office. And a lot of doctors don't even know that they're supposed to be doing that. So we go out and train them. So yes, I do have some time dedicated to this.
Mm-hmm. Now you're educating me. So I'm from Minnesota, and the one thing I noticed when I moved to New England here for residency in my patient base is oral health. Do you think oral health in this region of New England is a little bit poorer? Is it because of our New England? Is it because of the dental prepper? Is it the dentist doing something different? Is it the economy? What is it?
Yeah, some people call this a wicked disease. A wicked disease is something that's really, it's not just someone from Boston saying wicked. It's a really complicated disease. So you have to bring into all these factors. We don't have fluoride in the water in Worcester. So fluoride is something that helps protect your teeth and actually treat your teeth. Mass Health has a lot of benefits for people, but sometimes there are dentists in the area who don't take Mass Health. So people have a hard time finding that. People have transportation issues. People have other health issues. So all of these factors together mean that there's a lot of people in our county, in Worcester County, who continue to have poor oral health, which is, that's just a total travesty. When, like you, I grew up in an area where I had fluoride in the water. My mom got me to go to the dentist, got me to brush my teeth, and things turned out okay. So we really want to, this is a health equity issue. We really need to make sure that everybody has the same access and gets to have nice teeth like you and I.
Yeah, and that's where, so we're talking about Worcester. I live right down the road. Are there communities nearby? Let's talk about Boylston, Shrewsbury, do they have fluoride in their water?
For sure. So, and there's someone looking right now at this comparison of Shrewsbury and Worcester because of fluoride in the water versus not fluoride, and what's the difference. Also, some surrounding communities are a little more affluent, which means, if you're getting your dental insurance through work, then you get to go to the dentist and get your cleanings. If your parents, were more educated about the importance of brushing your teeth and flossing your teeth, and someone else wasn't, but take into account like veterans or homeless people or other people that live in our community that are our neighbors, and they may not get access for even other reasons, or people with significant mental health issues. So we have to factor all that in for sure.
Now, excuse my, I didn't have much training or no training in dental health. Fluoride, I remember as a kid I got it. I don't think my dentist has done it in the last 20 years that I can remember. Is it something that's more important as a kid and then less important later on?
Absolutely. So when the permanent teeth are forming, which is when a child is about 18 months old, a year and a half old to about age 3, we see their baby teeth, but their permanent teeth are forming underneath the gums. And so that's a really keen time to get enough fluoride. Mm-hmm. So for in our community where there's no fluoride in the water, physicians, nurse practitioners, dentists are meant to prescribe a supplement. Oh. And people should be taking that actually all the way to age 16, according to the American Academy of Pediatrics.
And so it's a pill, or it's a liquid you swish in your mouth? Is it daily? Is it once a week? How often is it?
Yeah, so babies get it as a liquid, and then once children can chew, it comes as a chewable. But just to put this in perspective, so if we had the fluoride in the water, you wouldn't need that. We would all get a little bit. And a little bit of fluoride is good for you and I as well. I mean, it continues to protect our teeth. Also, we get fluoride in our toothpaste. And one of the things that people get worried about is that too much fluoride. Not if you go by the guidelines. So a baby up to age 3 should just get a little smudge of toothpaste. You don't even have to squeeze the tube, just smudge it on. A 3-year-old to a 6-year-old could get a little pea-sized amount, and then as adults, we can put on more if we want to.
Now, it seems like an obvious question, but okay, how much is fluoride, and can't we just add a little injector into our water system in Worcester, and why don't we do that?
Sure. I mean, so many communities do that. This has come up for vote in Worcester 4 times, and the citizens have voted it down. And, I think what happens is there's a lot of misinformation out there. People feel that, can too much fluoride cause cancer? Can it affect your IQ, your intelligence? There are studies that kind of get published that aren't the best studies. So I've looked into this in great detail because, I've lived in communities where there's fluoride in the water, so I've subjected my children to it. Mm-hmm. I now live in a community where I have well water, so I have to give my children the supplements. So clearly I have faith in the science. But you do not get cancer from fluoride in the water. You do not even get like white spots, fluorosis from it. You don't get any of these things. What people are looking at is when you get massive amounts of fluoride. Like if you get massive amounts of aspirin or Tylenol, it's not good for you. And so those studies were mainly conducted there, or there's a little something there, but it hasn't been proven that that's bad for us. So we have to be really careful, like everything in medicine, to look at the science itself. And so far, all of the national organizations are continuing to say fluoride in the water is really helpful and not harmful. Great.
And let's talk about these patients, these children, that as they get older, they don't have enough fluoride. How does that affect, is it just the mouth, the teeth falling out, or are there other systemic effects on their overall health that you're finding?
Yeah, thanks for asking. I mean, this is why as a primary care, I'm so interested in this. If it was just a tooth getting injured and then having to be removed or getting a filling, that would be one thing. But when you get disease in your teeth, and then you get disease in your gums that surround the teeth, then you get inflammation in your body. As that drifts off around the body, it affects heart disease, it affects diabetes, it affects, believe it or not, they're finding links to Alzheimer's and other things. So this one part of our body affects so much of the rest of our body. The other thing, though, that I think people don't appreciate, even when they appreciate that, is that when you go to get a job, if you've had your front 4 teeth pulled, or they're like just dangling there, someone's not going to want to hire you. If you're a child and you're at school and those teeth have been pulled out and now people are bullying you, they've actually done studies to look at this, how much lost work, lost school, but also children's feelings of worthlessness, their grades. Literally we've studied this to show that this problem in the mouth affects all of that. So it's a huge deal that I think we have to really start to confront. And the Surgeon General did a report in 2000 and is coming out with a report in 2021 that again says, as physicians, as communities, we have to take this seriously.
Wow. And in Worcester particularly, because this is where the problem is, how are we doing with this overall oral health in Worcester?
Yeah, I mean, a lot of really good things have happened in Worcester. So I have to sort of, cite credit where credit is due. So we have our community health centers, Edward M. Kennedy and Family Health Center. They have really expanded their capacity to see more people with Mass Health, more people without insurance. We have the Ronald McDonald Care Mobile at UMass Memorial that goes around to communities, goes to schools and helps with some of these like fluoride varnish and things in schools. We have a lot of dentists who do take Mass Health, so that's important, but we could always use more. Mm-hmm. And there are, even more sort of public health measures that are going on all the time. I can't cite them all, but so that's the upside. The downside is we still have a lot of people falling through the cracks, particularly those who are Hispanic, particularly those who are Black, and as I mentioned, homeless, veterans. There's a whole list of people. So I think, we're only as good as the person in our community that suffers the most, right? I think we all rise together. And so there's definitely work to do there.
And let's say someone does have a primary care physician and they're in one of these classes you mentioned, like veterans, homeless, those with special needs, and they're unsure. Let's say they're children. Let's talk about their children, because everyone's concerned about their children. Once you get past 20, it's easier to fix things before. Can they ask is that something appropriate to ask their primary care? Hey, I'm going to a dentist. I don't know if I'm getting a fluoride treatment. How do I check this? Are there tests that you guys can do to evaluate it?
Yeah, and we're really trying to get all primary care providers educated. So at UMass Medical School now, we have a full curriculum that is a spiral curriculum. You learn the anatomy of the mouth, you learn how to ask questions, you learn how to look in the mouth, you learn how to put fluoride varnish on. So we're trying to get that into practicing providers as well. So for sure, and we're also trying to build a bridge of the gap between medical and dental. So electronic health records now have questions that should be asked. And ideally, physicians should know the dentist in their community. But yes, you should ask about that. You should be given advice about brushing, flossing, and then referral, and ideally varnish being applied in the medical setting.
That's great. That's great. I think we covered a lot, Dr. Silk, in this topic. If people are wanting to learn more, are there certain, website or knowledge bases where people can learn more? Maybe they're interested in what they've learned about, I don't know, about you or about some other organizations they could look at.
Yeah, I mean, the Academy, the American Academy of Pediatrics has a website called ilikemyteeth.org. Mm-hmm. So there is a ton of information on, for kids and oral health. The American Dental Association has a whole patient aspect where you can watch videos and all sorts of things. My own academy, the American Academy of Family Physicians, has oral health information. So yes, there's lots and lots of information. And I encourage people to learn how to brush your teeth better, or to realize the importance of flossing. If people are having troubles finding a dentist and they have Mass Health, they can call Mass Health and they will set them up with a dentist. So there's lots of resources around.
That's great. That's great. Well, thank you so much for your time and answering these vital questions. For those that are watching, I'm going to put these links underneath the video if you're on YouTube. Otherwise, we'll probably put them in the bottom of the video for the television program. So thank you, Dr. Silk.
Yeah, thanks for having me.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.